What's a good treatment for new hair growth?
I'm often asked by people experiencing genetic pattern hair loss about what can be done to stimulate new hair growth, or if there is a way to increase the number of hair follicles so they can have better scalp coverage. I'll discuss some basic concepts about hair follicles and some of the strategies we use to help men and women with hair loss. I'm Dr. Amiya Prasad. I'm a diplomate of the American Board of Cosmetic Surgery and a fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in New York City and Long Island for over 25 years. I've performed hair transplant surgery throughout my career. Results from hair transplant surgery can sometimes be frustrating because of the way hair grafts heal. I used a wound healing material called extracellular matrix by ACell to improve graft healing in transplant patients so more hair grafts would survive and grow. About a year later, I discovered that native hair that wasn't transplanted had increased in number and had grown in thicker. This discovery inspired me to develop a non-surgical hair loss treatment system using extracellular matrix by ACell with PRP as a standalone non-surgical treatment for male and female pattern hair loss. Since 2011, Tricostem hair regeneration has been the leading treatment in its category, with patients coming to us from around the world to our New York offices. The success of our system also led to our building a freestanding Tricostem Hair Regeneration Center in Northern Virginia. As I stated earlier, people with genetic pattern hair loss often ask how they can get their hair back. Unfortunately, genetic pattern hair loss is characterized by progressive thinning of individual hairs until follicles stop producing hair. In addition, some hair follicles appear to stop producing hair altogether and disappear. So does this mean there's no hope? No. As I mentioned earlier, we have been able to help people manage their hair loss with Tricostem hair regeneration. When your hair is thinning, the hair growth cycles behave differently than when your hair is not thinning. For the sake of clarity, hair has two phases, an active growing phase called anagen and a resting phase called telogen. When hair is thinning, the percentage of hairs in the growing phase or anagen phase decreases, and the percentage of hair in the resting phase or telogen phase actually increases. With Tricostem hair regeneration treatment, we've observed an increase in the number of hairs on the scalp, which appears to be the result of reactivation of hairs which were in a prolonged resting phase. In addition, we've observed individual strands of thinning hairs becoming thicker. Our patients are often so excited and describe what they see in their before and after photos as new hair growth. I remind them that we're unable to create new hairs, but rather what we've done is reactivate the dormant hair follicles that just weren't growing. Further, the combination of both increasing numbers of actively growing hairs with thickening of individual strands can result in significant improvement in scalp coverage. Our treatment protocol is based on a system or algorithm factoring in the patient's gender, age of onset of hair loss, degree of hair loss, and other medications taken for hair loss treatment, as well as other very important variables. This is in contrast to the generic PRP or PRP with ACell treatments being offered by medical retailers who require patients to come in every month to 3 months for scalp injections regardless of the individual's unique hair loss profile. A typical Tricostem hair regeneration treatment plan involves only 2 sessions about 18 months apart. Since 2011, we've observed scalp coverage improve for 3 to 5 years and longer with only 1 to 2 treatment sessions. Over 99% of our male and female pattern hair loss patients see a significant increase in scalp coverage. In summary, people with genetic pattern hair loss can potentially have better scalp coverage than they would have had without any treatment. The customized systems we have with Tricostem Hair Regeneration has helped people feel more confident about their appearance since 2011. I hope you found this information helpful. Thank you for your question.